Okay, we'll be talking about beta blockers. Beta blockers. We started a pharmacology series in the previous videos, and I said every day we'll be discussing, picking one drug, one class of drug, and talk about them. Discuss the nursing consideration, discuss everything we need to know, the key points, what they expect us to know in the NCLEX exam to help us pass. Okay, so the last time we talked about the AC inhibitors, which are angiotensin converting enzyme inhibitors. So in this video, we'll be talking about the beta blockers. Beta blockers. Okay, so I want us to understand that beta blockers are very, very important. We started with the antihypertensive medication. We talked about AC inhibitor. Now we are talking about beta blockers. They are important antihypertensive medication. You cannot give patients blood pressure meds without considering beta blockers. Why? The relax, the one of the problem that's associated with hypertension is vasoconstriction. The blood vessels, the muscles of these blood vessels constricting, especially these peripheral blood vessels, the arterioles, all right, they are constricting, increasing the peripheral resistance, making it difficult for the heart to pump. Even though we have other issues like what's it called, this cholesterol, the fatty plaques gathering, building up in the walls of these vessels that are preventing, reducing the lumen, the vessel lumen, preventing enough easy flow of this blood along the arterial lumen, right? So what beta blockers do is to help dilate the vessels, relax the muscle. Okay, the blood vessels, we have the tunica adventitia, the tunica media, and the tunica intima, right? These tunica media are muscles. Okay, now what the beta blockers do is to help relax this muscle, thereby reducing the pressure within them. When they relax, they will dilate. When they dilate, the lumen will expand, allowing a free flow of this blood to the tissues. Okay, so now when people take beta blocker, what are the problems related to beta? Before we talk about the nursing consideration and side effect and all of that about beta blockers, it's important for us to know that beta blockers, in the body we have beta 1 and beta 2. Beta 1 is in the heart muscle, while the beta 2 is found in the lungs. Now beta blockers we have the general beta blockers, which are also called the non-selective beta blockers, and then we have the cardio-selective beta blockers. The cardio-selective beta blockers, they act only in the on the cardiac muscles. Okay, but the non-selective beta blockers, which are the general ones, they work everywhere. Okay, they work on the beta cells in the lungs and in the heart. Okay, so when you are talking about the non-selective beta blockers, that's where you talk about the propranolol, the timolol, the carvedilol, okay, the labetalol, right? Then if you're talking about the cardio-selective beta blockers, that's the beta blockers that work only in the heart. You now there's this acronym ABIM. A for atenolol, B for bismolol, okay, another the E for esmolol, okay. Then we have the M for mesoprolol, right? Okay, so we said the cardioselective beta blockers act on the heart alone, while the non-selective beta blockers, they work everywhere. They can even work to help to manage portal hypertension in the liver, all right, for patients with liver cirrhosis, yes, hepatic problems, liver cirrhosis, where there's portal hypertension, to reduce the pressure within that vessel. Okay, so now why is it important for us to know this difference? The reason is because beta blockers that are non-selective are contraindicated in patients who have respiratory problems like asthma, like COPD. Why? Because they cause vasoconstriction. They can cause issues. Okay, vasospasm. They can cause that's the bronchospasm. Okay, when you give them, when they take it, in patients with asthma and COPD, it can cause vasospasm, which will further complicate the respiratory problem that these people are suffering from. All right. Then another thing again to know about beta blockers is that now generally beta blockers can mask symptoms of what? Hypoglycemia. Beta blockers, they mask symptoms of hypoglycemia, all right, which is why if any patient is taking beta blocker, you have to be checking their blood sugar, be monitoring their blood sugar, because because it causes muscle relaxation, and one of the symptoms of hypoglycemia is what? Tremor. Okay, so but when the patient takes beta blockers and the muscles are relaxed, it will not allow you to get this symptom. All right. Another thing about beta blocker is that apart from the fact that it can cause bronchospasm, which is why we need to be conscious about the type we use, making sure if that patient has a respiratory problem, we have to insist on using cardioselective beta blockers. And then I mentioned that beta blockers can mask signs of hypoglycemia, so we have to observe or monitor the patient's blood sugar in case the patient is diabetic. Okay. Now, another thing about beta blockers is that it can also cause orthostatic hypotension. Okay, so if a patient is on beta blockers, you have to teach the patient how to move, especially the elderly. Okay, teach them how to move. Like when they are rising up from the bed, they should get up slowly, get up and sit by the edge of the bed. Sit there for about 3 to 5 minutes. Then they will get up and stand before they start moving. They shouldn't just rise up and start moving like that. Okay, so um, that's how to prevent orthostatic hypotension. Okay, then beta blockers are very, very useful in managing hypertension, can be used in managing heart failure. Okay, remember it has a vasodilative effect. Okay, it has a way of calming the heart down. Okay, in heart failure, it helps the heart to calm down because there's so much ineffective beating of the heart muscle. So it helps it to calm down. Okay, so when we start discussing about medical surgical problems, we'll talk more on that. All right. Then beta blockers are also used in managing portal hypertension in patients that have issues related to what? Liver cirrhosis. Okay. Yeah. So for now, these are the much we'll take on this particular video. As we go along, we'll be talking more. All right. And please keep subscribing, invite your friends to watch, give me suggestion on topics that we can discuss on this channel. Okay, I am here for you. Please subscribe to this channel. Subscription is very free. Okay, please just subscribe to support me and to encourage me to do more. If this video is helpful, let me know in the comment section. Okay, if this video is helpful to you, let me know. This will also increase my motivation to do more. All right, thank you very much. See you in my next video. All right, bye. Bye.